So just to begin, I want to say how very pleased I am to be able to join you from England, what is in the evening for me, but I gather is noon for you. And thank you very much, those of you who've made time during the day to be able to come to this session. I gather they're normally in the evening for you. And I'm really delighted to have been invited to talk at this series of webinars. So I'm going to plunge right in and start with a quotation that's attributed to Nelson Mandela. If you talk to a man in a language he understands, that goes to his head. And if you talk to him in his language, that goes to his heart. Now, as Chris said, I am a psychotherapist by training. And as a psychotherapist, I am all about the head and the heart. And so you'd think that multilingualism, which concerns itself with that, would be at the core of psychotherapy trainings, but it's not. And I'm going to share my thoughts about that with you today. And although what I'm going to talk about today is only partially about interpreting, it is all about multilingualism. So I really do hope that you can find something useful for you from some of the talk. So I'm going to go to the slides now. So it'll just take me a moment to load them. And if I'm sharing them now, so if they don't come up, if you can't see them at all, if you can let me know. It takes me a moment to get them into slide share function. So if you just give me a moment for that.
We can see it.
You can see it, that's great. So I hope that you can now see the full slides as well. Great,
Perfect.
Okay, great, thanks Chris. So the title of my talk is Other Tongues, Psychological Therapies in a Multilingual World. And it is also the title of a book I wrote last year. So why am I interested in the experience of multilingualism in psychological therapies? Well, partly it's for personal reasons, and Chris has already given you a bit of a background for me in terms of my family. I grew up in a household with multiple languages, cultures, and religions. So my personal experience contributed to my interest in this, but so did my professional experience. So again, as Chris has already mentioned, I ran an organization that I set up in 2000 called Mother Tongue Multi-Ethnic Counselling Service. And we were based in the UK in a town called Reading, which is about 30 miles from London. And we were an NGO, and we offered free culturally and linguistically sensitive counselling for people from Black and minority ethnic communities in their preferred languages. And we were, all of us, the therapists who work there, we could all offer therapy in more than one language. But even though we could do that, and we were a small team, this was a small organisation. In Reading, 150 languages were spoken at the time when we were operating. And so we knew we needed to work with interpreters, and we wanted to work well with interpreters. So we formed our own group of interpreters, our own pool of mental health interpreters within Mother Tongue, and we trained the interpreters and they trained us so that we learned how to work together collaboratively. And then in 2018, we closed the frontline function of Mother Tongue, and we shared as much as we could with our local NHS service so that clients could still be helped, but they would be helped in a way that was more sustainable than just with one small NGO. But then we also moved into conducting research into multilingualism and working with interpreters. And I collaborated with my dear colleague, Professor Jean-Marc Duval, who is an applied linguist at Birkbeck, the University of London. And we continued developing training and supervision programs for therapists and interpreters, and continuing with research findings. We also ran and continue to run a bilingual forum for therapists and mental health interpreters, and that meets twice a year. And it has been, since the pandemic, meeting online. And I think it's very likely we'll continue doing that because we've now got an international group of people who attend. It is completely free. you are all welcome to attend, and all you need to do is just to send me an email to ask me to put you on the mailing list. And again, I'll send the link for all of this at the end. So as I said, we completed the work that we wanted to do in terms of frontline service for mother tongue. And then I set up a new organization called Pásalo, which those of you here who speak Spanish will know means pass it on. And the idea was to pass on the learning and the knowledge and the experience that we gained over nearly 20 years of frontline work, so that we could share that with other people, and so that more and more and more people could deliver the kind of service that we were delivering. And we did this and we continue to do it via training, research, and creative projects. So as I said, my interest is both personal and professional. And I'm just going to put up a slide that gives you an outline of what I'm going to be talking about today. I'm not even going to read that out because I think it speaks for itself, I hope. So why did I think a book about multilingualism and therapy was so important at the moment? Well, it's because the research really clearly shows us that multilingual people feel that they have different personalities, different identities when they're speaking in different languages, that they express their emotions differently in different languages, that they can process trauma more effectively in one language than another language, and that they appreciate a relationship with people who have an understanding of that process and who are also empathic and have an empathy towards the multilingual experience. But despite all of this evidence in applied linguistics, and despite the experiences of practitioners and clients directly in psychological therapies, the multilingualism just does not feature at all in the core training of any psychological therapies. And it's not just that it doesn't even feature, it's not even mentioned. And it just seems that the evidence from applied linguistics does not kind of make it to the shores of psychotherapy training and practice. It's kind of like it kind of gets there so far and something blocks it. And that seems to me really strange, given what I said at the beginning, the quotation that I mentioned to you at the beginning, that Nelson Mandela is attributed to have said about language and the head and the heart. And I've also included another quotation here from Joshua Fishman, who is a sociolinguist, who says that language can be the primordial home for those who may have no other they can call their own. So there are some very important reasons why multilingualism and therapy should be incorporated together. Now, it's not just they are important and nice to have, but they are also important when we're thinking about health inequalities in mental health for multilingual people. Because even if people are able to access mental health services, and that in itself is a question mark over it, if they're able to access the services, when they get to them, they will frequently find practitioners who just don't feel confident and haven't had any training in how to work effectively with interpreters, and may even be very suspicious of the whole process. And then I think we need to think really carefully about the fact that monolingualism is treated as the norm in psychotherapy training. And so I think it is really important we start to think about how are we deconstructing those monolingual underpinnings of psychotherapy models. Because as I've already said, clients have experiences, identities, and relationships in their multiple languages in different ways. And finally, a socio-political reason is that speaking some prestige languages gives you an advantage and a privilege, and it's a privilege that flows from colonization. And so today, in the year 2001, no, it's not 2001, 2021, even more so, this is time for us to examine this aspect of psychological therapy models. So we decided that we would try to work together and knit together the work of applied linguists and psychological therapists. So that we didn't want to do our research in a silo. We thought, let's use what applied linguistics have already learned, and let's combine ourselves together and see whether we can really create something that is useful for people. And we started off really by trying to answer some of the questions that other therapists would routinely ask us at Mother Tongue, because they just couldn't get any answers from their training institutions. So I've got a list here of the kind of typical questions that we were asked, and you'll see how they kind of started to underpin our research inquiry. So we had a series of questions about interpreters, and these are just a few examples. So therapists would ask, how can I form a relationship with the client when the client feels more comfortable with the interpreter than me? So it wasn't necessarily a judgment that they were making, just an observation. And it frequently is the case because the interpreter and the client share the same language. Another question from therapists, what do I do if the interpreter gets upset in the room? And you could say, well, interpreters shouldn't get upset in the room. But the reality is that sometimes it can happen. People are human beings. And therapists haven't thought about that in advance. And so it makes them very anxious. What do I do if the interpreter treats the client rudely? Now, I'm including questions from practitioners who say that they have had an experience like this, or they wouldn't be asking the question. And what do I do if I'm working with a couple and an interpreter, and one member of the couple speaks good English and starts to talk directly to me, bypassing the interpreter? Is that okay? So those are the questions about interpreters. And then we had questions about, well, what about if I'm working with somebody who speaks another language, their first language is different from English, but we're working together in English. They've got good enough English. They've got excellent English. Surely that's not a problem, or is it? So there might be a question like this. Why can't my Spanish L1 client remember any early memories when we're speaking in English? And why does my client say he feels like a different person in Cantonese? And here's one about accent, which is something I do a lot of training about now because it is such a sensitive issue and tends not to be addressed because it's so sensitive. And of course, here's a question from a therapist who tried to address it and got into a lot of trouble over it. So I couldn't understand my client's accent in English and tried to broach this with him, but he got very offended. What could I have done differently? And then the final question, how is multilingualism a potential therapeutic asset in the treatment of trauma? And that's what I want to be talking about really today, is how is multilingualism a potential therapeutic asset in any treatment of mental health? We tried to answer these questions. And I also, in the book, My Other Tongues, I try to answer the questions. And in the book, there are a lot of case studies from psychotherapy and training exercises. And the book also considers linguistic choices that are made in therapy. Why do some people choose that they want to work in one language? And why do they choose they absolutely don't want to work in a language? And the book is about how to work with multilingual clients and how to work as a multilingual therapist, because frequently people think that if you are a multilingual, you may have done all your training in English, but you speak your first language fluently. Well, surely it's just an easy thing, isn't it? Just to practice in your home language. But it's not. It probably won't surprise any of you here, but it will surprise many people. And that's one of the things that we think about in the book. And then we think a lot about how are you working effectively as a therapist with an interpreter. So let's take a very brief look at how we address working therapeutically with an interpreter. So I want to start us off with us just all imagining a situation where a client has access to an interpreter. And the interpreter for this client is a really good one, professionally trained, ethically sensitive, compassionate and boundaried. Even so, maybe the therapist starts to get a feeling that they are a little bit excluded from the relationship between the interpreter and the client. Okay, that was one of the questions that came up earlier about that sense of exclusion. And then maybe the client starts to think, is this therapist any good? Maybe she's not very good, and she has some doubts about her. So we're going to look at that situation with a little small clip from a film, because to go with the book, we created a free online training about multilingualism in psychological therapies and a film as well. And we're going to look at the first part of a filmed unit about the situation I just described. But before we do, this slide gives information about how to access this course, which is completely free, and to gain hours of CPD. And you can also watch the entire film through on which the course is based. And you can watch it all the way through. And the film's called Language of the Heart. You're going to see a little clip of it now. And the link for it is the second link on that slide. So let's look at a small fragment of the course. And Chris, if you can't hear it, if you can let me know, but if you can hear it, that's fine.
Do you know something? I think the training we had was really good, but I don't think it covered everything. I was working with this interpreter the other day, and it started off really well at first.
Frankie, whatever happened in your session couldn't be as bad as what happened in mine. My client started shouting at me. Sure, she was swearing at me.
Come on, it couldn't have been that bad. Maybe it just sounded worse because it was in Polish.
If you'd been a fly on the wall, you wouldn't be saying that now. Trust me, it was really bad. I feel ill just remembering it. So, how have things been this week for you?
Jak pani minął ten tydzień?
Dużo gorzej. Ona chyba nie jest dobra. Co ty o niej myślisz?
Ja jej to muszę przetłumaczyć i nie wolno mi odpowiadać na pani pytania.
Why are you having a conversation with the client? You're just supposed to translate.
This is exactly what I was telling Eva.
O czym one ze sobą rozmawiają?
She says, what are you both talking about?
I'm sorry, could you just tell me how you've been this week?
Loren mówi przepraszam i pyta, jak się pani czuła w tym tygodniu.
Okay, so this was just a very short excerpt, and you can probably see some of the familiar dynamics just in this clip. And the point in the film, from my point of view, is to raise all kinds of questions about good and poor practice, but to really draw therapists' attention to a continuum that I call the active-passive continuum. So a lot of my teaching for therapists, when I'm teaching them about interpreter-mediated therapy, is predicated on this continuum, because therapists are not always used to checking themselves to see how active they're being. And with an interpreter, they can just go passive without realizing. And so I'm just going to share a quotation about that. So not understanding what is being said can make a therapist feel disempowered, and they forget to stay active in a session. Frequently, therapists wake up to their responsibility partway through a session, when it may be difficult to regain their therapeutic position. And some of you here who've worked as an interpreter with therapists may recognize that process and that dynamic. And that's something that maybe we can talk about a bit more in the question and answer session. But I'm going to move on now to talking a bit more about our research. So as I mentioned, I conducted research with Jean-Marc Deval, and here's just two examples of papers that we wrote. One paper from therapists' perspectives and one from clients' perspectives. And we were also able, well, we won the British Association of Counselling and Psychotherapy Equality and Diversity Research Award. And I put that there for you to see, not just because, of course, we're very proud of that, but also because it felt like a real landmark in terms of these issues being recognized in a way by a national counselling and psychotherapy organisation. So the first paper that I'm going to be drawing from is a paper where we compared the attitudes, beliefs, values and actions of 101 monolingual and multilingual therapists who were working with multilingual patients. And the second paper, we looked at multilingual clients' experience of psychotherapy and counselling. And that we drew from clients from various countries. So it was an international study, and we were looking cross modality. So we didn't get too stuck on whether it was cognitive behavioral therapy that they had, or whether it was systemic, or whether it was humanistic, or whether it was psychodynamic or psychoanalytic. We were looking really in a meta way at the multilingual component and how that played itself out. And you know, across the board, it wasn't really attended to. So the modality didn't really seem that important in that particular study. So what were our main findings? Well, most of them I'm sure will not surprise you. The first one is, what a surprise, a multilingual client is different from a monolingual client. And that means whether they need an interpreter or not, even if they're really, really fluent in the shared language or the lingua franca that you're using as a therapist with your client, they're still different. But people feel different in their different languages, that they might have a different identity. Now, not everybody does, but the research shows us that the majority of people report that they feel like they have a different personality, and that they even, to an extent, the experiments are showing that people make different moral decisions when they are looking at exactly the same material, but they are processing it in either their first language or subsequent language. So what else did we find? Well, that the treatment of trauma can really, really make use of multilingualism as an asset. We'll see a little bit more an example of that in a minute on a little piece of research that was done with torture survivors in a therapeutic community. But it's so important that if you are able to retell a story in a language in which you did not experience the trauma, that can be a really useful helping step on your way to recovery. And if you don't have that resource, or you don't have that opportunity given to you, it's an opportunity missed in terms of recovery. So what else do we find? Well, no surprise that talking to somebody about their early memories, emotions, and relationships, you're not going to get very far unless you are able to help that person to feel that they can say some of it in the language in which they actually experienced it. It's the difference between explicit memories and implicit memories, which are encoded differently in different languages. And that people may, particularly people who have experienced very difficult and traumatic incidents in their lives or experiences in their lives, they may want to move away from a past self, a past experience. And that past self may be encoded in one language, and they want to use another language in order to live their lives in their present and their future configuration. And that they really appreciate, that multilingual clients really appreciated if a therapist welcomed them using their language switching strategically. So even if the therapist didn't understand, that they were able to create an environment where that the client's languages were welcome. So if I'm working in that way, for example, I will ask a client to think if they want to bring their language in to talk about something, and then they act as their own translator for it afterwards. in order to include me as well. I also am really careful when I invite people to bring their home languages into the room, because if there's been any trauma, it can suddenly completely overwhelm somebody to suddenly switch to their home language to talk about something. So when I'm assessing what I'm going to do, what intervention I'm going to make, I will sometimes invite a client to not speak their language out loud, but to imagine in their head what it would feel like if they were to be speaking to me in that language, in their home language, in the room. And that can help them to feel in control of where things are going. Because if they, at the just interior exploration stage, they say to me, Beverley, I just feel completely overwhelmed. I'll say, well, then I don't know that it's the right time for you to start doing that right now. Maybe we need to look at it and think about it and see how you can move a little bit closer so you can effectively touch that language and bring it into the room in a way that's not going to overwhelm you. And for some clients, it may be possible that they will never want to do that. And for others, it's part of the therapeutic process. And it's a way of us assessing together, how close are you able to allow yourself to get to that sharing your home language in the room with me. And so I hope this has all demonstrated that obviously clients' multilingualism can be a huge therapeutic asset, because it's an asset whether they bring it into the room or they don't. It's how we think about it and how we talk about it together. And that it's not just, multilingualism is not just a technical issue. So often people get very, very caught up in, we don't have a term for homesickness in our language, or we don't have the word for depression, or for obsessive compulsive disorder. And in some ways that's more of a technical issue, because what is really, really important in a mental health context is the relational, the embodied, the process aspect of the multilingual experience. Obviously, it's important to be able to get terms right as well, but it's the relational issue can be just pushed to one side and regarded as not so important. And what I would like to say is it's as important as the technical issues. So let me just say a little bit more about what we know about trauma. So this first quotation comes from one of our participants in the research. And they say, I felt more comfortable speaking about traumatic events in my native tongue. I feel that in my particular case, I was able to let go of pain easier thus. Okay. Now here's another participant, and they're saying almost the exact opposite. So I remember being asked to express an incident in the language in which, a traumatic incident in the language in which it happened. This I found very liberating. So the point here is there is no one size fits all. One client may really want to speak about a traumatic incident in the language in which they experienced it. Another person may find it fantastically useful to speak about it in a language in which they didn't experience it. And again, we're going to see in this dialogue in a moment that I'm going to share with you just how that plays out in terms of a real example of real people talking about this. So that was from our research. And from other people's research, we know that, for example, Aneta Pavlenko, who talks about the emotional detachment effect of subsequent languages. Now, I have to say that there are exceptions, that not everybody finds that their subsequent languages, their additional languages are less emotional. But it is frequently the case that the first language is most emotional and the second language is less so. However, when you're talking about trauma, it's the language in which the trauma occurred. So if the trauma occurs in English and that's your additional language, and your first language is Spanish, you actually may be able to talk about it much more freely in Spanish because the language that's causing you more anxiety is the language in which you experienced it, which is English. And so one of the things I think about when I'm working in this way is that this is part of a process in clients' therapeutic journey. So one of the real problems for us as therapists working with trauma is that in order to get some peace with the trauma, really what we're trying to do is get people to be able to go back and touch the trauma and not to be overwhelmed by it. Because when they come to see a therapist, if they have difficulties around trauma, it's like whatever triggers them overwhelms them. And so our job is to help people to just touch that trauma in some way. And so that's why I'm saying that if you can come at it sneakily and from another angle, using another language, you can just touch it, just, the tiniest amount that can be bearable. And then little by little, you might find that you can help a client to actually then retell the story of the trauma in the traumatized language. And that means they really can touch it and bear it and stay with it. A really quick story just to illustrate this comes from a colleague of mine who was a consultant psychiatrist at the Maudsley in London, which was is a very famous psychiatric hospital. And her name is Felicity de Zulueta, and she's bilingual in English and Spanish. And she was working with a young man who was very, very, very unwell, very psychotic. And he had experienced very, very severe early childhood trauma. And all of that had happened in English. Now, it just so happened that this young man had learned as a teenager at school, had learned Spanish and really, really loved Spanish and could speak it well. And so sometimes they would speak to each other, Dr. Felicity and the patient, in English, and sometimes they would speak to each other in Spanish. And the patient one day said to Felicity, Dr. Felicity, I just realized something. When I speak to you in English, I'm completely mad. And when I speak to you in Spanish, I'm sane. Now, that doesn't mean that he was cured, but it meant that the Spanish gave him some distance from the implicit memories of the early trauma. He was able to talk about them, but cognitively, rather than at an emotional level where he was completely overwhelmed. And as I said right at the beginning of this talk, our work as psychotherapists is helping people to unite back together the head and the heart. So flooding somebody with the heart or just focusing on the head ultimately is not the aim. The aim is to help them bring both together, but it can be that you need to do it in little tiny baby steps. So I'm now going to share with you a short dialogue that with Sally Cook's permission. So Sally was, she was doing her PhD and has finished her PhD. It's Dr. Sally Cook on the impact and functions of a later learned language with survivors of torture in the context of a therapeutic community. And her findings are absolutely superb. And I asked her permission to use a research methodology called performance ethnography, and to take some of the quotations from her clients and to put them together into a conversation, because I thought it kind of comes across, the presentation of her very rich findings, I thought might be better in a conversational format. And she agreed. And so I've got a dialogue here. And what I'd really, really like, I know this is supposed to be more of a lecture format, but I'd really appreciate it if 3 people would volunteer to read the parts. So there are 3 parts. There's Raymond, Dembe, and Maya. And if you would volunteer, probably the easiest way of doing it is if you can use the hands up facility or somehow attract Chris's attention, and then turn on, and if Chris, you can find 3 volunteers for me. If we can't do it, I'll read it out myself. But if there are 3 people who can volunteer, just take the first 3, and then I'll give out the parts once we've got the 3 people. Is that okay, Chris?
That's fine. Let's see if we can get somebody to volunteer. We have one. Theodosia Rivera is one. So
Fantastic.
Theodosia, if you can unmute yourself, please.
I think we've got Viviana.
Yes, I'm here.
Great. That's
Okay.
2. That's wonderful.
And do we need one more?
We do need one more. It could be you, Chris.
There's one, Giovanna Gonçalves, number 3. So why don't you
Fabulous.
unmute yourself, Giovanna? So now we have
Fabulous.
3. Do you want their cameras on as well, or no
If
need?
they want to, that would be lovely.
So why don't you turn, the 3 of you, please turn on your cameras as well, if you can.
Excellent.
So we have
So-
Viviana, Giovanna, and Theodosia. That's correct.
Theodosia. Okay. Right, I'll write Theodosia down because she's not appearing on my screen, just so I remember. Okay, so Theodosia, can you take Raymond? Viviana, can you be Dembe?
Okay.
And Giovanna, can you be Maya, please?
Sure.
Okay, so there are 2 pages of dialogue. Don't worry if you stumble a bit as you're reading. You've never seen it before. So you're doing us all a massive favor. You're doing everybody a favor because they don't have to listen to me for a little while. And there are 2 slides. So when we come to the end of one slide, I'll then flip over to the second slide. So I'm going to put the first slide up. And Raymond, Theodosia, when you're ready, if you can take it away.
Yes. We always talk together in English in our group, even though it is not our first language. It's not always easy. I get tired. It feels like a balloon.
What do you mean, a balloon?
I think it's because when you're talking, it is as if you put air in your balloon. You just want to fill this balloon, but in the balloon, there are some holes. And when you put the air in, the air goes out through the hole, so the balloon never gets filled, and you just get tired.
I agree, it is very tiring. That's why when I go to court or interview, I always ask for an interpreter. It makes me feel more comfortable because I can answer in my own language. In English, I'm always getting stuck because if I say I'm so sad today, that's not enough for me. I have got more to say and I don't know how to say that. The word sad is not enough. If I can talk in my own language, then I can explain about me.
It's the opposite for me. I don't want to say so much. It's too horrible. When I speak in English, I don't feel it. It doesn't hit you. It's like telling a story which didn't exist, but if I say it in Luganda.
You mean it is more difficult for you to speak in your mother tongue than in English?
Yeah, it feels like the language is a person watching me. If I speak in my mother tongue, so it's going to judge me. It's going to talk to me, telling me. I'm a bit nervous about talking in my L1. I see my mother tongue as a person that scares me and judges me. So that's why I feel really comfortable talking in English.
I don't think I have ever felt truly comfortable speaking English.
Sorry, I just lost the screen. Sorry. Denver lost the screen. Okay, here.
Oh.
You know what? For me, it was more even than comfort. I wanted to change my life, so I completely switched my language. The English language is my place of safety. It is from that place of safety that I can visit my pain.
Thank you so much. That was absolutely fantastic. I've heard it quite a few times, but I still find it very moving. I found it very moving when you read it, so thank you. So there are so many things here. There is the wonderful metaphor that Raymond uses of that balloon. You know, it's so exhausting speaking English. He can never, ever fill it up. The air keeps going out of it. And Maya talking about how much she really needs an interpreter to feel confident that what she has to say is going to get across. And then Dembe talking about how his first language actually is like a person that scares him, and that English, which is not his first language, is the language of safety for him from which he can actually visit his pain. So we're going to move towards finishing off now, so there's time for questions and answers. but just to say that from the research, we developed a frame called the Multilingual Therapeutic frame. And that frame is a frame about containing anxieties about language so that they can be explored constructively within therapy, and to integrate that into clinical supervision and training models. So what is our call to action? Well, our call to action is about being able to incorporate these ideas into core training. So there's awareness of monolingual bias in therapeutic models. There's awareness of linguistic privilege and power. That we find a way as therapists to create a welcoming therapeutic environment for multiple languages. There's a recognition of multilingualism as a therapeutic asset. And that the use of the lingua franca and an acknowledgement that sometimes it's an effort from people when they're speaking in English, just like it was for Raymond. This idea of audio racism, about what's happening in terms of accents. Are people discriminating on the basis of accent, or is it just being ignored and nobody's talking about it? And then there's the native versus non-native dilemma about why do we call people who speak multiple languages non-native speakers? Why are we calling them by a non, a negative, as opposed to recognizing that multilingualism is an asset? And then we need to attend to the fact that therapists will potentially be biased against interpreter-mediated therapy unless they've had enough preparation to prepare them for it. So I'm going to leave you with just the information about the book that I've mentioned, Other Tongues, and I'll put those links into the chat for you in a minute. I'm going to skip over a slide about the other products that we've produced, but you'll see them on the slide for yourselves. And if we have lots of questions, I don't want to take up the time for your questions, but if we haven't, I can come back to the slide. So I'll just flick through it very quickly now and just say that if you have been interested in the issues we've been talking about, there's the free course, the free film. And if you want to find out about the bilingual forum, then please do feel free to contact me on that email address. I'm also leaving you on the slides as well. There will be a list of some recommended reading as well. So I'm going to come out of the slide share now, and I'm going to put into the chat the links, and also hand back to you, Chris, for the Q&A, if that's okay with you.